everyone. My name is Jen Rainey, and I'm the Community Relations Coordinator for the Delaware Children's Department. And I'm really excited because we have a special video series for the month of May, which is Mental Health Month. We're going to be doing a couple segments on the Delaware Child Psychiatry Access Program, which is a new and innovative program that breaks barriers and connects families to psychiatric care right in their community. And I'm really excited because we have Dr. Mark Borer, who is a board-certified child and adolescent and general psychiatrist who's been in practice for a number of years. And he is a consultant with the Delaware Child Psychiatry Access Program, also known as DCPAP. So this first segment that we're going to be doing is basically, what do you need to know about the DCPAP program and how people can get connected? So Dr. Borer, can you kind of talk about, what is DCPAP?
Thanks, Jen. DCPAP is a program that brings child psychiatrists to primary care offices so that if people have a pediatrician or they have a family practitioner that is seeing their child and that child has a need for help with a struggle, an emotional struggle or a difficulty, then they can contact us through a phone number or an access line or a website, and they can get a hold of us, and then we talk with the primary care doctor or their representative and give them ideas for how to help. And in that way, people who may be on a waiting list for psychiatry or maybe seeing a therapist but don't have a psychiatrist or a psychiatric nurse practitioner to prescribe for them can get earlier service and interim service from someone like me.
That's awesome. And can you kind of explain, as we know, we're in a very unprecedented time with the COVID pandemic, can you kind of explain some of the concerns that, DCPAP can help providers with and families in turn to help them kind of work through any issue?
Sure. We know that there are a number of kids and parents that have struggled through the COVID crisis with changes in their daily routine, changes in how they go to school, changes in how they go to work, changes in how they access care. And the Child Psychiatry Access Program can help, again, through primary care doctors right in the neighborhood, wherever people see their primary care practice. We're able to help give input, and particularly right now with kids who are having anxiety and returning to school. We're having support for people who have depression, kids who have depression, which can be very common. And we even have some kids that are showing more trauma or even more substance use during this time, especially teens. So when they need some support, we can address that through both myself as a child psychiatrist talking with the primary care team, and we also have a behavioral health care coordinator, Mindy Webb, who's available for resources, for helping connect people with resources. The program is done through doctor to doctor, doctor to professional. It's not direct care of the child, but it helps the family practitioner or the pediatrician with their work with the child.
Awesome. No, that's great. And I know we'll kind of be talking about, the different resources and how providers can engage with DCPAP and other segments. But just as kind of a last follow-up, just kind of on the basics, how easy would you say is it for, healthcare professionals, to engage with DCPAP?
It's really easy, especially since we've done a lot of outreach in the community, and our program has actually engaged up to 200 professionals in Delaware for the program. So they already have ways to reach us. A number of them have already worked with us. Some have had repeat access for different patients so that people are getting used to it. People are getting used, and it's easy in that way. The other thing is, if there's a therapist or another professional or a school professional in the community that has a concern about a child, and they're talking with a parent, they can give them a brochure, access to the program to take to their primary care doctor so that if they haven't heard about it, they will. And then it's very easy, just a phone call or a click away.